Historically, in the Ukraine, some plants which people use for drug production is part of our culture. Plants like poppies and weed have been growing here for hundreds of years. We estimate that around 350,000 people in my country inject drugs. When we gained independence from the former Soviet Union in 1991, Ukraine inherited punitive drug laws. Drug users faced an HIV epidemic, a tuberculosis epidemic, homelessness, problems with low income, as well as human rights violations, and the risk of being marginalized or arrested. Over the 30 years since then, we have seen huge positive changes to the legal framework, although some laws are still in place for criminal possession and there is a list of types and amounts of drugs that are illegal. So, for example, Article 309 still says that you may be liable for arrest and imprisonment for up to 3 years for having just 0.005 of the gram of heroin or acetylated opium, which is shirka, in your pocket. That's the equivalent of the last few drops in a syringe after the injection, so formally, even a dirty syringe in your pocket can be the reason for arrest. Opioid substitution therapy began in the Ukraine in 2004. It followed the World Health Organization's defining OST as one of the most effective types of pharmacological therapy of opioid dependence, and strong recommendation to include OST in a harm reduction approach among injecting drug users. Methadone and buprenorphine are considered as the gold standard of medications used in OST around the world. Its approach is to treat drug dependency as a chronic condition with a high rate of recidivism. A friend of mine and I were part of the first pilot group of 30 patients in Kiev to take part. Basically, we were provided with specific medication, similar by the action to the street drugs, but in limited dosage under strict medical control. We were given a dosage of methadone or buprenorphine every day. The effect of the replacement drugs lasted longer than the street drugs we had been injecting and took away our dependency on them. The drugs don't give you a high, they just make you feel normal. After a certain number of months, once the dosage had been stabilized, we moved to the take-home stage, when we were able to take our medication at home. It meant we visited the clinic less and less, maybe only 3 times a month. It is important to understand that substitution therapy doesn't mean patients will necessarily stop using medications at all. For some people, it is a lifelong therapy, but they can live the full quality life. I immediately felt the change it was making. It was the same for all 30 of those patients who took part in the pilot project. It really changed our lives. Within 6 months, I reconnected with my family, I found work, I felt normal. Now I have home and family of my own. I'm advocating OST and non-stigmatized healthcare is now my profession. I'm still on the program, but now my dosage has dropped from 24 milligrams a day to the minimum of just 4 milligrams of buprenorphine. It opened doors for us to all other health treatments of HIV, Hep C, and psychological services. Believe me, OST improves patients' quality of life, reduces their risk of illicit drug use and overdose, and improves their health and that of the people around them. In 2005, a public hearing took place to decide whether this kind of medically assisted therapy should continue. I gave evidence about how OST had changed my life. The result was that the Ministry of Health gave the green light to substitution therapy and turned the pilot into an approved treatment program for drug dependency. At first, OST was part of the HIV/AIDS prevention program, but now it is available as a kind of treatment for all people who inject opioid drugs, including its availability on the primary healthcare level. So currently, there are more than 13,700 OST patients at 215 sites across 25 regions of Ukraine. Just over half of them are at the take-home stage. But due to the COVID quarantine measures and lockdown reality, up to 90% of them were moved to take-home approach. Now it's the biggest harm reduction program in Eastern Europe and Central Asia. The provision of opioid substitution therapy is now guaranteed in law in the Ukraine. Since 2017, the state budget has covered the procurement cost for the medications, paying for methadone and buprenorphine. But organizations like the Global Fund still pay for other wider and extremely important social psychological support. However, by 2023, these rehabilitation and resocialization costs should be also transited to the state budget or local budget. And step by step, the goal is to increase coverage by up to 3,500 patients each year. By 2030, the goal is to ensure at least 40% of people who inject opioid drugs in the Ukraine are supported by substitution therapy, in line with WHO, UNAIDS, UNODC recommendations to reach the global sustainable development goals.